Welcome to the Dental School Guide podcast, your ultimate destination for all things dentistry. I'm Dr. Tanner Townsend, your guide through the complex world of dental education. Join us as we uncover the secrets of acing dental school admissions, navigating residency programs, and exploring career opportunities. Please share and enjoy. Real quick, just wanted to make all you pre-dental students out there aware of a resource. If you've ever been worried about getting into dental school or are wanting to get into that school of your dreams, then you definitely want to check out a program called Dental School Guide. In the program, we walk you through how to save money, time, and heartache when applying to dental school. There's so much fluff out there when it comes to resources for getting into school, and we are streamlining all of that. With our comprehensive digital course, expert mentorship, and personalized application review services, you'll have everything you need to stand out to admission committees. Take advantage of this amazing resource that will help you increase your chances of getting into dental school. You'll want to check out dentalschoolguide.com. Check it out. Podcast. I'm your host, Dr. Tanner Townsend, and I'm here today with Shivani. Shivani's a D4 at The Ohio State University, and we are super excited to have her on. Shivani, welcome to the show.
Thank you so much for having me.
Well, we are pleased to have you on. So, Shivani, for those of us that don't know you very well, give us a little bit of background about yourself and how you ended up at Ohio State University.
Yeah, for sure. So, like you said, I'm a fourth year at Ohio State right now. Kind of started off on a way different path in pre-med and ended up discovering dentistry across the way. Applied to a couple different schools. I was in the COVID cycle of application, so I really kind of tried to spread myself out. And Ohio State, I grew up in Cincinnati, went to undergrad at UC, so ended up at Ohio State. Was a great option for me.
That is awesome. So you said you were pre-med. So walk us through a little bit how you transitioned over to dental. What was the thing that kind of sparked you to decide dentistry was the place for you instead of medicine?
To be completely honest, growing up, I didn't know dentistry was a path. And I think a lot of people come from that background where you know a dentist exists, but you don't necessarily know like the schooling that they have to go through or the background that they come from, anything like that. If you don't have any family that's in dentistry, which is kind of a background that I came from, no one in my family is in healthcare. So I kind of explored that myself. And I think the first shiny toy that you see in healthcare is physician. And that's like everyone else. I kind of started there. In middle school, I ended up shadowing a physician and was like, oh my gosh, this is so cool. And then you see like shows like Grey's Anatomy and they show you like this insane perspective of healthcare. And you're like, oh my gosh, that's so cool. Like that's exactly what I want to do every day. And then I kind of explored that as I was like volunteering kind of on the back end of healthcare, doing a lot of more mundane patient work. And then in my undergrad, I finally decided to like, okay, if this is exactly what I want to do, then I should kind of full send and see, put both feet in and see what happens. So I ended up being a medical scribe in the ER. And for anyone that doesn't know what that is, you basically kind of follow a physician around the ER and you chart for them, you write their notes. So you see every single patient that they see. You go through a typical shift with them. So you're there for nights, days, you're kind of there whenever they schedule you basically. So I was taking like classes during the day and doing that more towards like the nighttime. And that's where I really got talking to the physicians. And I was like, tell me a little bit about yourself. Cause I was really able to build that relationship over time with the physicians I was working with. And they were basically like, why are you going to medical school? Like, have you considered other options? And I was like, wait, why is everyone telling me like not to go? And that's when I finally kind of also evaluated, like, what do I want in my life? Like the work-life balance that I want to be able to have kids and do stuff, and travel is like so important to me. So it's like, okay, maybe I should step back and see like what other options are in healthcare. And then that's kind of how I ended up at dentistry.
That is really cool. It's really interesting you say that because I think there's a lot of physicians out there that regret, unfortunately, going down the path that they went down. And you don't hear that as often with dentists, which is, I think we're super blessed to be in such a profession that supports each other that way and has a good work-life balance, which is awesome. So Well, today, Shivani, we really want to get to know more about your experience at dental school. And we want to hear how Ohio State has kind of transformed you into the future dentist that you're going to be here in just the next year, which is awesome that you're going into your D4 year and you're almost done. So tell
Exciting.
us a little bit about Ohio State. Like, what is the atmosphere like in general? And then we'll kind of get a little bit more nitty gritty as we go along.
Yeah, Ohio State is known, most students or even dentists know Ohio State grads as someone that has really good clinical skills. So I think Ohio State really prides themselves on that, which we do so many clinical things. Like I had a couple friends that go to dental schools in other places, and the time that we held the drill versus some of the other schools was way different. Like for us, literally from day one, first day, our operative class, we were holding a drill and working on a block. And I think that's very different from some other schools where you kind of go through a semester of didactics and then you start doing the hand skills. And for us, it was really exciting because it's like, okay, like you're going to dental school to be a dentist, and this is dentistry. So it was great to see from day one being able to practice those clinical skills rather than having to do like more of the didactic work right off the bat.
That is awesome. So they had you prepping teeth within the first week then, huh?
Yeah, we had the little block, which everyone that I guess goes to dental school is aware with. You just have like a bunch of squares and you're like trying to make shapes and circles and doing the different things. That was our first couple of days. And then like second week out, they were like, okay, 30 occlusal, go. And they showed us how to do it. And you mess up, but that's how you learn.
Yeah, that's just how you do it. So in
Yeah, I was
terms,
going back and like looking at the stuff I did as a D1 because we're like cleaning our lockers, and I'm like, I can't believe I used to think like this is amazing. You like to think you're producing like amazing work right off the bat, but it's awesome.
yeah, you look back and you're like, oh my gosh, that looks awful. It's funny how that the progression goes and you continue to grow and you're like, man, I did not know anything. I thought I was so smart back then. So walk us through, let's kind of walk through the first 2 years first before we kind of get to the clinical years. So during your first year, how does Ohio State format their classes? Is it half and half in terms of didactic versus lab time? And is it pass fail stuff? What does that look like?
So our first year is mainly dedicated to our anatomy course. That is where we spend like 80% of our time in school, out of school. That's our hardest course by far. And I think we're one of the few schools that still does the cadaver dissections. So we're in conjunction with our med students and we're doing full body upper, yeah, upper from the chest up. So basically, NGI. So we do everything hips up, we do dissections.
That's great.
And I think that's a really unique experience that we get because I know we're talking about our first year, but like now that I'm studying for boards, I'm like, oh, I can go back and like imagine those like veins and arteries and stuff that we cut. I think that really helps kind of instill those for a longer period of time. And also kind of puts a little bit of like the practical part of it into perspective too, because you're like, oh yeah, this is like when you're giving an IAN, you're supposed to give it here, but if you see it on a real person, you're like, okay, that's the IAN. That makes sense why you go there. So that's kind of a lot of our first year is a lot of anatomy. And our classes aren't pass fail, so we get a letter grade. And then other than anatomy, we have like our operative classes. So we have some clinical classes as well as some other didactics like histology and the basic of the general sciences, but mainly you're dedicating most of your time to anatomy. Like if I think about it now, I'm like, yeah, anatomy was like the only class I took.
That was the staple of D1 year anatomy. So as you go into D2 year is typically the year that like is super duper heavy in terms of just coursework difficulty level, so on and so forth. At least that was at my school at VCU, that was definitely the hardest year. So what does that second year look like for you at Ohio State as you're going through as a student?
So I think something that's different for Ohio State, I think not all schools are in the summer in session too. So we have our summers in session. So after our D1 year, that following summer, we're still in classes. They're not as much or as significant classes, but we're still here on campus, which might be a little bit unique from other schools. And then into our D2 year, it's just like you guys, it was quite the year. Like looking back, I'm like, if you can make it through D2 year, you can make it through dental school. There's nothing worse than that one year. And for us, it is very clinical heavy. We do a lot of our cross, our endo, like all of our specialties courses are basically our second year. All of our first year is more towards operative and learning the basics of fixed. And then second year, we have our ortho classes, our endo, our perio, all of those classes are all that second year. And if I think back, I'm thinking about dentures. That is where we spend a lot of our second year is lots of dentures, lots of denture repairs, spending lots of time setting teeth, moving
Oh,
teeth.
yes.
And then one unique thing I think at Ohio State is we do basically what's like our Ohio State practical boards where we have 10 different restorations or fixed or 10 different procedures basically that we have to pass before we can move on to our D3 year. And that's a majority of our spring semester of our D2 year. You're doing a lot of that practice and then you take those board or those practicals, I guess, and then retakes and all of that happens during our spring, as well as you take a written exam as well. That is kind of meant to simulate like the part one of boards that's no longer. So they can kind of test your clinical skills as well as your academic skills before you move into clinic.
Wow, that is kind of unique that you guys do that before you enter clinic. So I'm assuming still that you're taking practicals before that time as well, correct? Yeah. Or is it? Yeah.
So we are taking practicals kind of throughout in each class. We have practicals. So it's very similar to most schools, I think, where we're graded on like a 0 to 4 scale. Where 2 is like passing. And then that final class is where we're kind of assessed on skills that we've learned in all of those courses all the time.
Wow, that's really cool. I think that's actually really valuable that I haven't heard from a lot of different schools because oftentimes they'll do little things to test you before you're ready for clinic, but it's not quite as board-like as that is, which is really unique. So in terms of when you get to clinic, it varies so much from school to school. As you've probably known as you've been talking to friends that have gone to different schools. What are some of the unique experiences you feel like you've been able to get at Ohio State that you may not have gotten at a different school in the clinic?
I think scheduling wise is like the biggest topic that a lot of students talk about. They're like, oh, is the school going to schedule? Do you have to do it? So for us, when our summer after D2, we're kind of handed like a folder of patients that were once upon a time D4's patients that we're now responsible for, basically. You don't get like a lot. You get like probably 8 to 10 patients that you're starting off with. And some of them might just be recall. Some of them might be a denture right off the bat. You kind of don't know what's coming in that pot. And then after that, you are on different types of rotations throughout your third year, which can help you kind of get more patients. So we're on what's called new patient rotation, which I think is different from a lot of other schools where you're scheduled to be on this rotation where there's patients that have called the school and are saying, hey, I want dental care. So then they schedule them with us to try to basically triage the patient. And then we also have our emergency rotation where we see kind of just walk-ins, and that's a way of recruiting patients too. But we schedule all of our own patients. You're kind of working like your own private practice person, your own schedule.
Well, that's awesome. And you had mentioned before we got on the call today that you're just about to start some external rotations where you kind of go out in the community and are able to kind of get a little bit more real world dentistry experience. What does that experience look like for you at Ohio State? How many weeks are you guys out? What kind of procedures do you guys get to do on those rotations and so on?
Yeah, so that's a lot of our fourth year is kind of they kind of get your feet wet, and then fourth year they're like, okay, go, basically like setting you free. And you are on for 10 weeks. in a span of your fourth year across sites across Ohio. So it's mainly for a lot of the underserved population is kind of who you're seeing. And the school, you get to like preference. There's about 40 sites, and you kind of put top 5 that you would want to go to. And each site has different things. So if you're interested in peds, there's sites that see more kids. If you're interested in special care dentistry, there's sites that see special care patients. So you can kind of go into a niche if you really prefer that. Or you can kind of spread yourself out and use that year as like exploring what you want to do post graduation. And we are basically right now, I'm at an office that's about 45 minutes away, and we see a lot of Medicaid patients, and it's a lot of more emergencies. So I'm learning how to do a lot of extractions, and it's really unique because it's similar to having being working in a private practice where you don't know you know your schedule, but you don't necessarily know what's about to walk in the door. It could be someone that you initially had scheduled to do a root canal, and now they come in and the entire tooth is fractured and you have to extract it. So it's been a really unique experience also to see the different types of patients and the different types of patient populations that's kind of coming in through the door has been very unique experience. And it kind of also gives you a perspective on like timing as well. So at our school, we see 2 patients a day. We have a morning and an afternoon. Whereas when you are at these sites, you're expected to run basically as a full sufficient dentist. And some offices will have like a whole column set out for you, and they schedule patients before you come, and you're kind of expected to keep up to pace with that column. So it's been a really unique experience to also just test out my clinical skills as well as to see like patient management, because the patients that we have in our practice, it's like you develop this relationship with them and they become like someone you know about their kids, you know about their family, everything. But when you're at these external sites, it's someone you're seeing for the first time. And without building a relationship, you have to be able to kind of calm the people that have more of the anxious tendencies. And if they need something that they don't necessarily like, it's kind of your job to convince them or to convey them one way versus the other. So it's kind of really helped me figure out like my communication skills and like my interprofessional skills are working with a lot of doctors. So it's a very unique experience.
Wow, that is awesome. So in terms of other experiences that you get during your D4 year, a lot of times schools will kind of limit the amount of like root canals you get to do or wisdom teeth you get to take out or other things that are a little bit more on the advanced side. Do you guys get any of those experiences at Ohio State that you might not be able to get in a school that has a lot of specialty programs?
I think that might be my only like qualm with Ohio State is we have every specialty. So it's amazing for when you're trying to discover, like, do I like ortho? Do I like perio? It's great because you get to just kind of walk into those specialty clinics and be like, hey, can I shadow? And you get that exposure right away. But also it kind of sets us back because if there's something that's like a complex cross case, it kind of automatically gets assigned to the graduate students. Whereas you don't necessarily get to kind of try some things out. Like if it's a long bridge, it kind of automatically is like, okay, that's grad pros. And I think at some other schools where if there's not a grad prosthodontics department available, then it's like, okay, then somebody has to do it. So guess it's got to be you, like figure it out. So I wish our school kind of did a little bit more of that versus the referrals, but it's great to be able to explore and try to figure out if you don't already know, like coming into dental school, that you want to go into a specific specialty. I would definitely say pick a school that has the specialty so you can kind of explore a little bit of each.
That's some great advice right there. All right, so we're going to kind of move into some questions that are about school, but a little bit more on the lighter side. So what are some fun things to do about that are in the area of Columbus and around Ohio State?
That's a tough one because I am a big Cincy girl. Like I love Cincinnati, grew up in Cincinnati. So coming to Columbus, I'm always like dogging on my classmates that grew up here. And I was like, there's nothing to do here, but there's so much to do for sure. There's a lot of like food. The food scene is like amazing in Columbus. and there's a lot of like restaurants, there's a lot of like festivals, especially in the summer. There's a lot of like food truck festivals, and they had like a strawberry festival. So it's definitely, if you're an outdoors person, there's a lot to do outside in the summertime for sure. And there's a lot of different like events that just randomly happen as being like, I guess, the state capital. There's a lot of marathons and different types of events that are kind of happening throughout Columbus, but definitely the food scene is amazing in Columbus.
That is awesome. So with that, are there any things that like dental students kind of typically congregate to do kind of together in general? Um,
Yeah.
like
Our I think a lot of dental schools have the um Delta Frat, so that's our dental school also has a chapter. So every football weekend, Ohio State is big on football. So every football weekend they have a tailgate. So most all the dental schools kind of that's kind of where you meet as a D1. That's like kind of where you meet your friends, and they throw a lot of parties, especially your D1 year, where it's kind of like a intermingling. And I think Ohio State does a really good job incorporating all of the four classes together. It definitely doesn't feel like it's D1s, D2s, D3s, D4s like separate. We do a lot of like intermingling, so there's a lot of club involvement at Ohio State. So you meet kind of throughout all four of the classes. And I think that's the biggest thing is our frat does a lot of events, especially during football season, that kind of everyone kind of comes together for. And at least our school, our class, I think most of the classes at Ohio State are really big on sports. So we have like a soccer team, people go and play like pickleball. There's a lot of, I think, athletes that end up going to Ohio State. So there's a lot of like volleyball and all that teams too.
it sounds like it's super involved, and you guys have a good culture amongst the students, which is cool. What's the housing situation like? Every school is a little bit different where some, like all the students live in one area versus they kind of live out 15, 20 minutes away, kind of away from the school. What does it typically look like at Ohio State for a dental student?
Yeah, so our first 2 years, I would say, especially the first year, a lot of people tend to live within walking distance to campus, just because you kind of are there a lot for your first year doing the dissections. You spend a lot of time after class, so it's nice to be a convenient walk home. And then your second year, those dentures really get to you. You spend lots of hours after doing dentures, so people like to live close to campus, and that's kind of what I did as well as some of my friends. We all stayed really close to campus our first 2 years, and then like I was saying, your third and fourth year schedule you kind of dictate it yourself. Outside of the rotations, the school kind of tells you about the rotations, but then third and fourth year people tend to kind of move away towards like the nicer areas. There's like currently I live in Grandview now, which is more like kind of mellow area. By the school, it's a lot like there's a lot of undergrads that also live over there, but more near Grandview, it's like people that are working or slash even like grads, other people that are in like med school. So they're people our age, I think, more than they are in undergrad. So it's a nice kind of more mellow scene down here. And then you're also closer to just like some of the food and the like fun situations everywhere.
Great. Well, what's the parking situation like? Some schools require that you have to pay for parking every semester. I remember my school required it was like something obscene. And so I just parked on the street because I was like, I'm not paying that. So do you guys get charged for parking, and is it close, or do you guys walk typically? It sounded like you walk the first 2 years typically if you're living close to campus.
Yeah, so our first 2 years, as people do live there, they normally walk. But there is like the people that do live away. Like a lot of people in our class also have like families, husbands, kids, so they don't necessarily live close. And there's like a parking lot that's dedicated to the students that are in the south side of campus, which is where the dental school is. And it's a little pricey for sure to do the parking there. But there is parking, I guess, there. You just have to pay for it. I know it's not as fun. We don't have like an amazing parking lot. I know some schools have like a great parking lot that's like dedicated for students, but unfortunately that's not us.
That's okay. Another kind of unique feature that some schools have is they have like a gym even dedicated for the dental students in the dental school. Is that something that Ohio State offers at the school?
No, but our gym is, or there's a gym that's part of Ohio State's gym that is literally a block
Oh,
down
that's
from the
great.
dental school. So it's really nice because I think Ohio State gyms are very good quality gyms. There's a lot of amazing equipment, especially if you like to lift, which I that's kind of my like biggest stress relief. So I love to lift, and a lot of people I think in dental school. It's really weird because I didn't think about that coming in, but I think like almost 50 to 60% of our class lifts. So it's fun to see your classmates like all at the gym together, especially our D1, D2 year when we all lived close. We all would go to the gym and then you would get ready and like go to school together. So it's like it felt like it was like high school again. Like everyone gets off the bus and like goes walks to school together.
Yeah. I remember at our gym, it was especially like after we took practicals, they'd make us wait to get our grades, and we'd go to the gym and like play basketball or something like that, or like just go lift for a little while before you're like waiting for your test, anxiously waiting. So yeah, it's kind of a fun congregating area for dental students. It seems to be a great spot for that to happen. So
Yeah, I think it's like so weird. So many dental students I think across the country are all like really big into lifting and working out, which is amazing. So
it's a good
it's
thing
the
to
work
be.
life balance. I guess that's why we all ended up here is we want that work life balance. So.
Exactly, exactly. All right, well, let's move into some questions about pre-dental students. So we really want to know, Shivani, some pre-dental advice that you have for people that are either in the process of applying to dental school or will be applying to dental school in the years to come. So you had mentioned in the beginning that you kind of applied during the COVID years and like started that process during that time. So your interview experience is probably a little bit different than what it's going to be for future students. But tell us a little bit, just in general, what was your interview experience like at the different schools that you applied to and interviewed at?
Yeah, my experience is a little bit different, which is kind of how I justified being fly, and I think was the biggest convenience that came out of the COVID era. There was so many inconveniences, but that was a good one. All of mine were virtual interviews, but a lot of the schools did a great job incorporating students as part of it. And I think that's definitely a green flag to look for when you're interviewing. See if there's students that are on a panel or students that are doing the interviews, because if you ask them questions, if they look happy, if they look like they are content with the school, the program, then it's pretty easy to tell, especially if you ask the hard questions and the students don't have a problem answering and they're giving you like a genuine answer. I think that's definitely a green flag to look for in schools. Whereas there's some schools that didn't have a student as part of any part of the process. There was no panel, there was no students interview, there was no like Q&A. And I was like, this is a little bit fishy. Like, why are students not volunteering for this, or why are students not wanting to share their experience? So at Ohio State, they ask all of us fourth years and third years if we want to interview the incoming class. So I've had the opportunity to do that this past year. And it's awesome to be able to see, because you see like you were once upon a time them, you know how nervous they are. So especially if you see a student on a panel, I would definitely just ask them the raw questions that you have for them, because I think that's the biggest way during an interview to see if that school is the right fit for you. And also the faculty that are interviewing, kind of ask them like what they don't like. I think as a pre-dent, you're focusing so much on making sure you're pleasing the school that you kind of sometimes forget that you have to find the right fit for you. Like what happens when you get into multiple schools?
Mhm.
And I think that's what we forget when we are pre-dents is the fact that it's, oh my gosh, I just need to get into one. Like, no, you have to find the right fit for you. You want to be able to be happy when you're there, because these are going to be the 4 hardest years that you've had in your academic career yet to come. So I think that's the biggest thing to keep in mind during interview season.
That's great. Well, we're going to kind of piggyback off what you just said in terms of having the opportunity to interview students while you were in your third year. So, what were some of the things that you really noticed that were good things that students did that you were really impressed with? And what were some things that may be things to avoid?
Do not talk about dentistry so much that it seems so fake. Like everybody that's interviewing knows that you love dentistry. Like you just spent so many years and so many classes trying to get into dental school. Make that interview about yourself. Make that interview about what you like to do. Bring out your personality because at the end of the day, they know your grades, they know your DAT, like all of that stuff is already on the paper. So right now, focus on bringing out your personality. What are some things that you like to do? Incorporate those into when they're asking you, like, what are your three biggest qualities, which is a really big question that I think comes across in so many interviews. Make sure you're kind of incorporating, like, if you really like to swim, talk about swimming. If you really like to do art, talk about art. Don't spend so much of that time being like, oh, my most memorable time in undergrad was shadowing this dentist. Like, they know it's not shadowing the dentist. Like you have so many experiences in your undergrad years. And for so many of us, that's like one of our most memorable years as undergrad. You have so much fun and be able to express that in your interview. I think stay away from dentistry. Not saying that like don't talk about any of your dental experiences, but focus more on you as a person and more about your end goal at the end of the day because dentistry and dental school is only 4 years of your life. There's so much more.
Mm-hmm. They really want to see that you're well-rounded. And I think a lot of times, like you said, we get a little pigeonholed and try to answer the questions that we think they want to hear, but it's really they want to see that you're a real human being and you're not just some dental robot that's going to just do this the rest of your life and have no life outside of dentistry. So that work-life balance is
I think
go
that's
for it. Sorry.
part of like talking to your patients. I think at the end of the day, whoever's interviewing you knows you have to be able to relate to your patients. And your
Yep.
patients don't want to talk about dentistry. So I think that's kind of what they're looking for when they're looking for candidates is people that at the end of the day can talk to a patient, not only explain to them that the dentistry that they have to do, but also connect with them because patients don't want to come to a dentist that is just going to come in, put their mask on, drill in their mouth, and get out. They want to come to a dentist that one can be articulate and be able to explain their thoughts, their ideas, their feelings, and the best treatment plan for them, and also be able to kind of connect with them. And I think that's why a lot of people come into dentistry is like you want to build those connections. So just show that across in the interview.
Mm-hmm. I think that's huge. So what do you think is something that really made you stand out when you were an applicant, when you were applying to dental schools?
I took a gap year. Part of that was the transition from my pre-med to my pre-dent. And during that time, I worked as a dental assistant. And I think that is one of the biggest things that I did that really helped me not only during my interview process, but also after I got into dental school. And while I was a dental assistant, I definitely did not know what was going on. I didn't take any dental assisting course. I kind of just cold called a lot of offices near the area that I was living at. And basically was like, hey, I am a pre-dent. I'm applying the cycle. I know it's COVID, but if you want an extra hand at the office, I'm willing to kind of do whatever. And I kind of left it really broad and open and got a couple phone calls back that were like, hey, will you come sterilize instruments? And I was like, sure, anything that's in an office, like I'll do it. I'll come in. Ended up learning like how to sterilize, how to assist, how to take x-rays, how to work the front desk, how to talk to insurance. Like I learned so much during that period of time. And it wasn't even a long period of time. I was there probably for about 6 months. And I was able to talk about that in the interview so easily that I think every single one of the interviews that I did, I talked about being a dental assistant and how COVID kind of transitioned into that and incorporating like COVID and how being able to like communicate with patients and all of that was part of that. And I think that really stuck out to them. I think that was one of the biggest things. And then the second biggest thing was research. I think not a lot of dental students do research. And to be completely honest, I started my research being a pre-med. Preterm birth was something that I was really passionate about that hit home for me. So I did a lot of preterm birth research, and it had nothing to do with dentistry, but in every single interview I was in, they pointed out the fact that I was doing preterm birth research, and they loved it and wanted to talk about it, talk about like the experiments I was doing. I did a lot of dissections with that too. So I think part of that came with they wanted to talk about the hand skills of doing those minor surgeries on the animals that we were working on. But I think research is something that's very unique that not a lot of dental students do that can really make an applicant stand out.
I love it. I love it. That is great. Well, as we're kind of wrapping up here, do you have any final words of advice before we kind of wrap it up for tonight for pre-dental students out there?
Yeah, I would definitely say for sure, put yourself out there. As a pre-dent, you're really cautious on the actions you're making. You're like, I don't want to cause a bad impression. But I got into dentistry by reaching out to a bunch of dental students that were dental influencers, which is kind of how I got the passion to start my own and ended up with Rise and Floss. But I basically just DM'd a bunch of them when I was starting to think about dentistry. I was like, hey, can you give me your thoughts? What do you think about dentistry? What do you think about dental school? Because I was finding that med students were the ones that were like, don't come. So I was like, okay, let me talk to dental students and see if they think it's a good idea. So from that, I would say definitely put yourself out there, not just about that, but definitely just with opportunities. Talk to the dentist, talk to your own dentist that you've been going to as a kid and be like, hey, can I help around the office? I think that is probably the biggest thing. Don't be shy. Really just put yourself out there and trust me, the opportunities will come the more you put yourself out there. And two, try to do something in undergrad that makes you stand out outside of dentistry. For me, it was starting a club that I started in undergrad. That was a healthcare competitive club. It didn't have anything to do with dentistry, but it was something that I was really passionate about, as well as my research. I was very passionate about my research. So being able to, I think, show that passion in your interviews and your application is something that they will also look for as well.
Well, awesome. Shivani, that was excellent advice. Thanks so much for sharing your experience at Ohio State and just some advice to pre-dental students around the country. Well, that is it for today on the Dental School Guide podcast. Shivani, thank you once again.
Thank you so much for having me.
All right. Thanks. Have a great night.
You too.
That's all for today's episode of the Dental School Guide podcast. We hope you've gained valuable insights and inspiration to fuel your journey into dentistry. Don't forget to subscribe to our podcast for more expert advice, inside tips, and engaging discussions. If you enjoyed today's episode, please leave us a review. It would mean the world to us. Until next time, keep smiling, keep striving, and remember, your dental dreams are closer than you think. Thanks for tuning in to the Dental School Guide podcast.